My name is Sarah Schultz. I'm the director of the Rehab unit and the Wound Care Center at Parkview Medical Center. I've been with Parkview 18 years. I have some oversight over the hospital injury prevention program for our pressure injuries. That team looks at process improvements, anything that helps patient outcomes to help prevent negative effects when it comes to pressure injury prevention. In the hospital, we weren't doing much of anything, and that's why this is so great, because you can capture those images. The nurse's documentation on initial onset of the wound was lacking, and so I think the nurses are excited that they have this, that they're able to capture the image, and that is their documentation. Managing the documentation discrepancies or variations was difficult, especially when it came to risk management and liability for the hospital for those inconsistencies in those documentations or just different descriptions. Anytime they see any abnormal skin conditions is what we've taught them. They need to capture those images, so we have documentation on when that occurred. So looking at those that have acquired in the hospital, we go back and we track those. And when we track them, we look at when was that first documented by the nurse. So we're really going back and educating the nurses that they need to capture those images immediately before they wait for consulting a wound care specialist. We had one patient that we were struggling with getting a diagnosis on a type of rash, a skin condition, and the nurses were able to capture the image with silhouette star, contact a specialty physician, and get treatment over the phone by just the physician being able to view what that skin condition looked like. And so the treatment was able to be started 8 hours prior to what it would have been before we implemented silhouettes. It is awesome when you look at that. It really does help the continuum of care from nurse to physician to wound care to surgeon, all aspects. You've got a surgeon that's in the OR and can't break free to come look at a wound that's dehisced or something like that, that they're able to see how urgent that needs to be taken care of. So I think it's really time saving too from a physician standpoint on being able to view those images from off campus. When the patients are unable to visualize some of their wound injuries that they have, being able to look at that themselves and see the wound healing, it lifts their spirits a little bit. It's been very impactful for the patients. I would definitely recommend Silhouette in other facilities because of the accuracy of the wound images and the documentation and the enhancement of communication among caregivers.